EMS brings you a young woman who was witnessed to have a seizure and has this physical examination finding at bedside. I was impressed by how many of you correctly identified this physical examination finding, which is called the Schwastig sign. Not a lot of you, though, noticed the bandage around the patient's neck, indicating that she recently had a surgery. So the correct diagnosis is hypocalcemia in the setting of a recent thyroid surgery. So this patient actually had a total thyroidectomy because of thyroid cancer. And the pathophysiology is interesting. So low extracellular calcium will result in increased neuronal permeability of sodium, meaning basically more sodium goes into the cell, lowering the threshold for depolarization. So any type of mechanical stimulus like tapping on the facial nerve will result in twitching of the facial muscles. Another physical exam finding is called the Trousseau sign, is when you inflate a blood pressure cuff and then you notice that after you inflate the cuff, let's say in the patient's upper extremity, you'll notice spasms of the hands and fingers. And that's also a positive test indicating hypocalcemia. But why would the calcium be low in this patient? Remember, this patient had a total thyroid removal surgery for thyroid cancer. And the main glands that are responsible for raising calcium level in the blood are the parathyroid glands. These glands are located behind the thyroid and they can be accidentally removed during surgery. These patients are treated with intravenous calcium in the acute setting, usually in the form of calcium gluconate or calcium chloride, and they're usually admitted to the hospital for close observation to make sure that their symptoms are not getting worse and make sure that they have good follow-up with endocrinology to get the proper outpatient management.